Hey coaches, I'm Dr. Kevin Burroughs with Atrium Health Musculoskeletal Institute. I'm the head team physician for the Kannapolis Cannonballers, Catawba College, and A.L. Brown High School. I'm also the venue medical director with Charlotte Football Club and a medical consultant with Cabarrus County Schools. Thank you very much for watching, and we hope that this video will help answer some of the questions you might have about concussions. What is a concussion? A concussion is a temporary dysfunction of the brain that occurs after a traumatic event. That could be a blow directly to the head, or it could be into the rest of the body, and sometimes it's even just a deceleration or a slowing down force that allows the brain to make movement within the skull. When that happens, there is a discharge of some of the chemicals that occur in the brain, and that causes kind of a downward trend with it. It'd be much like if you were trying to run through practice and you got fatigued. You get to the end of that practice and have to run additional laps. It's not that you can't do it, but you certainly can't do it as well. And that energy loss is what leads to several areas within the brain being affected. That leads to you not being able to perform at your maximal capabilities. What are the symptoms of concussion? When we're trying to evaluate these athletes, particularly on the sideline, or if we see people in the clinic, what we find out is that they're having initially things like headache, dizziness. They may start to get a little nauseated with it, and then as they are trying to go through things, they find difficulty with being able to focus, concentrate, and as you go more progressively, they could have more difficulty with lights or noises, particularly in loud stadiums or inside of arenas or other things such as that. As we're evaluating athletes on the field, a lot of times it's subtle things that we're trying to look for. Patients oftentimes just don't feel right. They feel fatigued or foggy, and that's the descriptor that's used. We have to go through a series of questions. We have to look at different aspects to try to make that diagnosis of concussion, because again, these symptoms not only may not happen right away, they can develop over the first 24 to 48 hours. And coaches in particular, whenever you see your athlete get a big hit, that's the person that you want to keep your eye on. They may have symptoms that are very subtle, and one of the things that you can help with is identifying, are they missing their assignments? Are they not going where they need to? Is the difficulty with focus whenever they come over or you talk to them and they start to look like they may have a vacant kind of look to them or staring out into space? That's when you could enlist the help of the athletic trainer to see about a more thorough evaluation and make sure that we're not missing any of these concussions. So again, one of the difficult things that we have is trying to make the diagnosis of the concussion. A lot of this is based on report of symptoms, and unfortunately sometimes the symptoms don't get reported directly, or at least up front. So what we need to do is be vigilant in those athletes who have received a blow that might lead to a concussion, and just monitoring them if nothing else as they go forward. If you do start to recognize difficulties with focus, concentration, other symptoms such as headache, difficulty with lights, please get in touch with someone so that we can do further evaluation and see if this could be related to a concussive event. How is a concussion diagnosed? Well, particularly in the sports environment, we have certified athletic trainers at all of our schools that are out on the front lines and can actually do an evaluation on the sideline. They know the kids very well and can actually see that there are some subtle changes that are occurring in them. Once that evaluation is raising the suspicion of a concussion, they'll get in touch with one of the physicians at the Musculoskeletal Institute to get in for a more comprehensive evaluation. Now with that, we actually go through several stages to try to make this diagnosis. We will evaluate the ocular motion or eyes. We will look at balance and other kind of disturbances that may be able to be picked out off of a physical exam. We also want to know about the history and about any other types of medical conditions that might affect our ability to make that diagnosis of concussion, or that would cause that concussion to last for a more extended period of time. One of our difficulties in the diagnosis of concussion is oftentimes, unlike a sprained ankle that might swell, we do not see any outward signs whenever we start dealing with concussion. This is true not only on the field, but as we go forward. Regarding imaging, oftentimes we get the question of, should I have a CT scan? The answer is that that does not really make the diagnosis of concussion. And it's really reserved for those high impact moments, such as getting ejected from a car or falling from a height, something that would be a more significant blow. That might lead to the possibility of a bleeding in the brain, and that's when we utilize CT scan. It's more for the evaluation of those major traumatic injuries. What is the treatment for concussion? From a coach's perspective, what to expect whenever we're trying to treat these kids for a concussion? Well, we're going to have to modify some of their physical exertional capabilities, so we may have to take them out of running or other types of exercise such as that. We are going to have to make some modifications. They may not be able to attend practices or games at first because of their significant symptoms with noise or light. So there will be modifications that we need to do in that realm. As we allow them to improve, then we can start adding back in gradually more things that they're able to do. Typically speaking, most concussions can resolve for pediatric and adolescent athletes within 2 to 4 weeks. That doesn't mean that everybody takes the maximum amount of time though. So if we just recognize appropriately, rapid intervention for it, that can get the athlete back on the field much faster. What happens if a concussion is not caught or not diagnosed or not treated correctly? The challenge here is that if it's not diagnosed and the athlete goes back out, they can certainly suffer a more significant injury if they get another blow to the head or even again just to the body. It can make their symptoms last for a more prolonged period. And again, each concussive episode causes more trauma and more of a decrease in their brain's capability to function. So the earlier that we can make this recognition, we can make an accurate diagnosis, be able to modify them, and be able to allow them to return to activities, both in the classroom as well as on the field, in a much more rapid fashion. How long does it take for me to get better and return to sports? Once the athlete is no longer experiencing difficulties in school and with mental capabilities, then we can advance them along from the school perspective and start them on the return to play. The return to play takes 5 days. And as they're going through this, the idea is to increasingly exert them to a higher level and to add in other things that might cause symptoms to recur. We're monitoring them carefully as they go through this return to play, and if there are symptoms that recur, we need to modify what would happen in regard to advancement. If they are doing well, we can progressively get them back and make sure that they are safe to go back into sport activity. Am I more likely to have a concussion if I've had a previous concussion? And the answer to that, unfortunately, is yes. And with each subsequent concussion, it can increase the likelihood that you would have another concussive event. This is why it's so important for us to make sure that we can have people completely cleared and that they are back functioning at their maximum capability to hopefully decrease the chance of long-term complications. How is Atrium Health dedicated to keeping these athletes safe? Well, we start out with all of our athletic trainers that are out in the schools. We really help with education, we help with awareness for the coaches, the staff, and also for the parents and teammates. This on-site awareness and education allows us to make an accurate, quick assessment to make sure that if there is an athlete that has a concussion, we get them plugged into our system. After that, we have our sports medicine and injury colleagues who can do a comprehensive evaluation and make sure that we get the athletes into the types of therapies they need. We have a wide cadre of different physical therapists, occupational therapists, that can help with cognitive issues, vestibular issues, and ocular issues. And this is how we can push athletes to be able to return to play as quickly as possible. When the concussion is a more significant injury, then we can actually make referral to a lot of different specialists within the Atrium healthcare system that can allow us to be able to give you the best care possible. Thank you for watching. We hope that this video was helpful in understanding the recognition, diagnosis, and treatment of a concussion. Our team of experts are always here to care for our students, athletes, and their families.